Here we are in Sabangarun Kupana. So they are distributing the Mexican tablet because this community is endemicity for onchocerciasis, that's river blindness. So now the CDD will start going house by house by using their own register and holding their measuring stick together with their drugs. So now we want to start the distribution for 2016 mass administration of medicine in Sabangarun Kupana at Kajuru local government in Kaduna State.
NTDs affect 1 billion people worldwide and have quite a devastating impact on people in developing countries. They affect things like life expectancy, childhood education, and productivity, which leads to a cycle of poverty and stigma. Nigeria in particular suffers from having 100 million people affected or at risk of these NTDs. Some of the entities that we addressed in the project are schistosomiasis, bilharzia, elephantiasis, hookworm, whipworm, just to name a few.
It's not just that these diseases are neglected, but the people affected with these diseases also feel neglected.
What we did first was we carried out a preliminary assessment of the entire supply chain system in the country to see what was on ground and what intervention we need to offer as experts in supply chain system.
The drugs that we use are donated by donors free of charge. And the only requirement is that we are able to account for the drug utilization, which is a condition for receiving the next consignment. And with the support of Crown agents, we've been able to manage that situation effectively.
One of the changes that we have made on the program revolves around the integrated warehousing. Prior to our arrival of Crown agents, commodities get stored in multiple locations, and that often creates challenges with accountability and knowing what exists at one point in time. But we promoted the use of integrated warehousing, and that has greatly improved the level of accountability and visibility of inventory in the whole supply chain.
Another thing that we are bringing into the consortium is the reverse logistics. So apart from the items just going out, we also ensure that any commodity that is unused will have to be taken back and accounted for. There are a lot of items there that are really expensive. It has a huge street value. So we want very clean, clear, transparent accountability of what happened to every single tablet that would have been seeded into the system. So for anyone that is not used, we will have to take it back.
The national NTD program, we have adopted our tools, the tools that were developed by Crown agents. And the plan now is to roll it out across the whole country, so that other NTD projects beyond United will use the same tool, so that we'll be able to overcome perennial issues of inability to account for drugs. So that's one legacy that I'll be very proud of at the end of this project.
We also piloted the integrated training model. Rather than several partners doing their own training in different days, we work with other partners to be able to have a one-day training that incorporates different components: program management, monitoring and evaluation, data management, and inventory management. That actually saves a lot of time, and it also saves a lot of cost in delivery of training.
They have come up with a standard operating procedure for drug supply chain management, which has been accepted by the national government and is being rolled across the whole nation beyond the United supported states. Crown agent is also responsible and has been supporting capacity building.
And that building capacity is not only in the state level. They did it in the local government level, like where the frontline health facility, that is a health worker, in the remote place, down to the implementer, that is the community directed distributor, and the teachers also. So that whether they are present or they are not present, it's still useful for us. So capacity building is very important.
What brings pride to this project is actually impacting life. To go out there and actually see smiles on the faces of these people is something of joy. It's a project that I have quoted in almost every place that I found myself at. It's just wonderful to identify with the project.
When I hear individual case studies in the field, the transformation that the treatment has brought into their lives, the changes and how that has affected their well-being and their economic status gladdens my heart.
What makes me to proud in this project many people are blind due to river blindness. But when they started taking Mectizan tablet, many people now say, we are seeing, but formerly we are blind. That makes me to be proud. So it will make me to be very happy. Say that neglected tropical disease is not neglected now.